I do a dedicated job in perinatal mental health. I do clinics and everything, looking after mothers with mental health problems. I have seen mothers from all walks of life. I never, when I was becoming a doctor, I was focusing on mental health in pregnancy. I used to think that, only maybe certain sectors in the society, they are vulnerable. Yeah, it's true. But I have seen mothers from all different financial, social, you just name it, all professional background, educated. So it is nothing to do with what you do, who you are. It can affect you. So please remember that is at least what I will suggest as a doctor. So we know that it can have an impact on the mother. I'm not going into detail, but pregnancy is a wonderful opportunity. It's a wonderful opportunity to many things. To adopt lifestyle changes. Which can, if you take that up, that can carry on not only during pregnancy and after childbirth. That can actually help in the future life as well. So this is a wonderful opportunity. And mental health problem, to address and identify them, this is wonderful. Because, again, in my career, I have seen that many mothers for the first time, they have said that, they have problems with eating disorders. You might have heard about anorexia, bulimia and all those kind of things. They have disclosed for the first time. And another thing what I've seen, I think Soigat briefly mentioned as well, that often they are treated as anxiety and depression. But there may be some very serious illness might be there. He talked about bipolar or psychotic illness. I have seen many patients who were treated for a long time with anxiety and depression. But when we explore further, and this is exactly what I keep on saying, that pregnancy, if you have any health problem, it is identified because you're seeing so many doctors, so midwives, you're getting so many visits, even if you're completely fit and healthy. So why shouldn't we take that opportunity? So please remember, no one is immune, and I'm not going into detail. Now, next question. How many of you feel that stress can have an impact on pregnancy outcomes? Thank you. So, majority of you, it's absolutely true, as my previous speaker said, that it can have an impact. Now, as an obstetrician, I often used to think that, because when we study any medical complication during pregnancy, we try to find out what impact it can have. Like, for example, if she has got a heart problem or neurological problem, for example, epilepsy. So how it is going to have an impact on the pregnancy? So, when I started reading about that, I never thought that mental health problems can have an impact. I used to think that, okay, if she's feeling low, you treat the depression and that's it. But this is not true. In fact, I'm not aware of any other medical complication during pregnancy with such a wider impact, not only in her life, but in her family life and her professional career, her quality of life, and in fact, the entire society. And in fact, there was a study in 2014 which showed that, in UK, they spent 8.1 billion to treat all these problems we talk about, and 2/3 of the money we spent to problems they have for the complication of pregnancy. So, and 1/3 of it actually to treat the mental health problem itself. So it is so useful. This is another result discussed in the media, but we don't explore in scientific terms whether it's true or false. Stress can make a child personality disorder. Yes, it can have an impact on that. And there is another one. And after when it is published, I often get a lot of messages on my social media profiles, Twitter, Facebook. Oh, Dr. Raja, I had stress and all these problems in pregnancy. Is my baby is going to have a brain injury and all those things? But at the same time, yes, we know the fact. But at the same time, we have to reassure them. First of all, it is a treatable condition. It's absolutely 100% treatable condition. If we provide appropriate care, treatment, it is 100% possible to treat mental health problem, and full recovery is possible. It's not the fact that if you start antidepressants and you stay there for whole life. It doesn't happen if you get proper diagnosis. This is why I keep on talking about diagnosis, diagnosis, and diagnosis. And the third one is it doesn't affect every child who is having. It is actually only a small section of we don't know at the same time that which baby is going to be affected. But it is always better to have a universal approach. We will be talking about that by our next speaker. And this is all actually in the media, and so you could already talked about that. But one of the important things what I need to stress, what I see as an obstetrician and gynecologist, is a preterm labor. That is, the baby might born early, and if they are going through quite stressful situation during pregnancy, or having a computer programming. You know, those who know about the computer programming, so you basically make some changes in your computer program so that actually it can function properly in the future. So exactly the same thing. What happens during pregnancy, not only the baby's different structures grows, heart, brain, you know, obviously from 2 cells, from 1 cell, it actually grows to an entire human being. So it's the entire process. But at the same time, how these organs are going to function, specifically brain, that actually is programmed in fetal life. And that is why it is so important to address that in pregnancy. Because if you address that right from the word go, then actually sort out many problems in the future. Okay. So as I said, it's not a new concept. You know, it is new from our Vedas, and all will be more will be talking about that. Now, someone, Shoikat was talking about the cortisol pathway. We don't actually know that how this fetal programming happens. Now, it is quite interesting. You know, what happens during pregnancy, the stress hormone level, the cortisol, actually goes I'm just repeating that because some of you join later. So the cortisol level goes up, even if you're stressed or not. You know, it is a normal pregnancy changes. But what happens in this, but this cortisol cannot go to the placenta. I think I have a photo here. So this placenta, this cortisol actually cannot go to the baby because that enzyme we are talking about. Even if you don't remember the name, don't worry about that. But there is something that prevents. You all know about placenta, by the way. I'm keep on talking about the placenta. You know, so placenta actually works as a filter. So whatever happens, that protects the baby all the time. So at the same time, the cortisol cannot go. But what happens during pregnancy? We don't know why it happens. That if the mother is having stress during pregnancy, that enzyme or the chemical that prevents that cortisol supply, that doesn't work very well. So as a result, a lot of cortisol actually crosses the placenta and affects the baby. And the cortisol is harmful to the baby. It affects the baby's brain. It affects the baby's growth because if it is affecting the placental cells, obviously baby cannot get good nutrition. And as a result, baby is not growing very well. That is how you get low birth weight babies. They have an impact on the baby's brain. That is why they develop brain problems in the future. So this is one of the theories. We still don't know why it happens. But as I said, I keep on telling every time it is better to have some information. But at the same time, we should not be scaring mothers that, you know, if you're having stress during pregnancy, that is the end of your journey. It's not true. Because it doesn't affect everybody. Because Mother Nature, most of the time, takes care of everything. And that helps the doctors as well, by the way. Sometimes we forget or miss something, and Mother Nature takes care. And that is exactly something happens here as well. And there is another thing called epigenetic thing. Now, although it sounds very medical or very scientific, in very simple words, epigenetic, you know about genes, you know about the DNAs and everything, but epigenetic means, you know, for any organ, or how we look like, how we function, how we think, everything depends on our genetic configuration, how the genes are expressed later on in life. But what happens, even if you have the very good genes, it cannot be expressed, because there can be some minute changes in pregnancy. So what happens, there can be some harmful chemicals that can develop out of stress. We still don't know which are the chemicals are. That can have an impact on that can affect the genetic expression. So that will prevent, even if you have a good gene, that may not be expressed. Or it can modify the gene a little bit. That is how you develop different health problems in the future. So that is how. Again, this is a theory. But there are a lot of evidence coming up. A lot of scientific studies into that. And at the same time, there are a lot of other theories are there. I'm not going into detail. Hopefully, maybe in a future opportunity. But is that all clear to you, or is it too medicalized information? Is that okay so far? Okay. Yes. Now, what can this is just a summary to show what mental health problem or stress can have an impact in our life. In our life means the life of the mother and in our society. Now, and as an obstetrician, I'm not aware of any other medical complication during pregnancy which can have such a wider impact on her life and the entire society. So we know about the effect on the mother. It can have an impact on the quality of life. It can destroy someone's life as well for good. I've seen mothers, I've followed them up very, very closely. I've seen their journey. We had one mother today. She had to go, but I've seen throughout my life how it can have a awful effect on their future life. Dr. Shoaib mentioned about post-traumatic stress disorder. Sometimes it can traumatize them the whole entire pregnancy journey in such an extent that they don't want to become mother in the future. That is just the end of it. That breaks down. That can have an impact on the relationship. So it can have an impact on the partner as well, on the other part, and it can have an impact on the relationship as well. So you can well imagine that such an impact it can have during pregnancy and in the years to come. We talked about attachment. Now, very simple term. Again, we often use these words, bonding and attachment. Have you all heard about that? How the baby reacts or responds to the mom. Now, this is thought to be one of the important factors for the development in the forthcoming years. If you have a very good attachment, if the baby feels very secure in a mother's arm, usually the baby develops very well. But if there is problems in the attachment, that can have an impact in their growth and development. And mental health problem can have an impact on that, including stress and relationship problems. How many of you, okay, let me go back to this one. Okay, I'm assuming you haven't seen the next slide. How many of you feel that dad can be affected? Only a few hands. Oh, I'm really, okay, there are many. Yes, it can have an impact on the other half as well. So when we talk about mental health problems on the mother, we should not forget the dad as well. And again, in my career, I've seen, although there are actual data on the male partner, in my career, I've seen that the same-sex partner, or, sometimes in that, someone in that role. For example, she might be a single mom, or sometimes I've seen a mom who the husband died, in early part of the pregnancy. But she was supported by her friend, one of her friends. And she was so traumatized, she developed PTSD because she has seen the entire journey. She didn't want to get pregnant. So that is how anyone in that particular supportive role can be affected. So this is very, very important. So yes, dads do suffer too. We have to remember the other half as well. Okay? And again, I keep on saying that I haven't seen any other medical complication during pregnancy which can have such a wide impact. Anyone would like to focus on that? Any of your journey? I always open this one particular, I stop and take a pause here. That anyone you have seen as a member of the family or as a dad who you have witnessed and would like to say something? Thank you.
Thanks, Raja. So my name is Samrat. I'm in a kind of profession which requires me to travel a lot. And pregnancy happens to the both spouses. We, as the dad and the mom, we go through, or the probable dad and the mom, we go through pregnancy together. So obviously, when the mother goes through such kind of an event, when the mother goes through such kind of a traumatized pregnancy, it affects the father as well. Now, I said that I'm in a profession where it requires me to travel a lot. So what happened is that when my wife was pregnant, and by the way, she suffered a miscarriage to start with, and her pregnancy was the second pregnancy that was fruitful. At that time, I could not spend too much of time with my wife because I was traveling all the time. Now, We had support from our parents, but then to remember, we are probably the first generation who has seen globalization, modernization from the very nearby, world. So obviously there is a big generation gap that happens, and most probably our parents do not understand us quite often. So yes, there is that difference of understanding that happens in the domestic life. There is that fact where the woman goes through issues which she cannot share with others, and most of the times the woman itself might be a working woman. So think about the fact that while she is going through pregnancy, there's always this thought in her mind that I'm actually losing out the 6 months or 9 months that I'm out of my work. So there's this professional, competition mindset that also troubles. Now, I have seen this from very close quarters. My wife was, out of profession for almost a year throughout the pregnancy because the pregnancy was actually tough. Now, how did it affect me? It was actually a big thing on my side because I sometimes did not know how to react to certain questions, certain behaviors that I saw in my wife. So yes, dads go through a lot of mental, health as well, and that needs attention. And it needs attention as a family, as the spouses together, because this journey happens, for both of them. So probably while you talk, you might be talking in more intrinsic ways of, debating about what happens. But I think it's a very, very important factor. And with the generation moving ahead, with we competing with the other global powers in the world, I think it becomes very, very important that pregnancy now should be looked after on the family rather than to one person, which is the wife.
Thank you very much indeed. Big hand for Samrat for this. It's really difficult because as a male member of the society, we often feel that we have to be at least show very strong. But often I've seen again in my career that parents coming, the fathers coming and breaking down. And one of my very good friends, Mark Williams, is doing quite a lot of work. He has actually written a book on how it affected him and his during his career. So anyway, let us move on to our next one. We mentioned about the mental health problems. Now, one thing I need to stress again, as an obstetrician gynecologist, that it is never ever too late to seek help and get medical advice to treat mental health problems during pregnancy or afterwards as well. It can be before pregnancy, that is ideal opportunity. But again, if someone hasn't disclosed, that's fine. But if someone develops, it can be done at any stage of pregnancy or afterwards as well. So please, if someone is telling you about mental health problems during pregnancy after childbirth, just encourage her to seek help. Not all the time she needs extensive medical or psychiatric care. Most of the time, with simple support and a bit of a very simple non-medical treatment, she can get better. And that happens in most of the time. Not going into details of that. And it is important now, the guideline shows in the UK, there is a nice guideline we follow as an obstetrician and gynecologist. It is saying, now it is advising that each and every interaction during pregnancy, we should be asking about mental health. Because again, there is another very important myth, that if you never had any mental health problem in the past, you can never develop mental health problems during pregnancy or afterwards. This is not true. In fact, in majority of the cases, they do not have mental health problem, who develop serious mental health problem, or even committed suicide. They never had mental health problem in the past. So we should not be ignoring them. That okay, you're absolutely fine, that should be okay. You're not going to have any mental health problem. And actually, it is easier for them who had mental health problem in the previous life. Then it is easier for them to accept. But often there is a denial among many mothers. They do not want to acknowledge the fact that they are very successful in their career. They're from a very good background, so they cannot develop mental health problems or perinatal mental health problems. No. This is not true. Okay. So another important thing is how many of you feel that antidepressants or all the different medications can be used safely during pregnancy? How many of you raise your hands? It is okay to take medication during pregnancy? I can't see any hand going up. That is a bit scary actually, but exactly where that is where we are. This is why it is very difficult to treat mental health problems during pregnancy. You know, if it's not, she is not pregnant, if you go to see a psychiatrist, he or she will be very comfortable in giving you medication. But once you're pregnant, first of all, most of the doctors, they're not exactly sure whether to give or not, like as we are. And second is that for the lot of, many of the mothers are very worried to take medication during pregnancy. And rightly so, because we don't actually have much evidence. So what we need to do, this is why we have to work with the mother as a healthcare professional, that we have to weigh the risks and benefit. Like any medication, most of the medication, we try to actually avoid medication during pregnancy. But sometimes it is important. For example, if you have diabetes on insulin, insulin is important, even if it might have some side effects. So exactly the same way, that is exactly what we talk. We work as an obstetrician gynecologist. I work with a psychiatrist and then give the information that yes, we both agree that maybe this is the right thing you need to think about very carefully. Yes, might be some risks, but the risks are very low. So it is okay to give some medication. In fact, the Royal College of Psychiatrists, they suggest that we should not be suddenly stopping medication. Because as Sukul was saying, 7 out of 10 mothers who stop medication during pregnancy, they have relapse. So we have to be very, very careful in stopping medication. I always give the example of insulin. You should not be, you should not be stopping insulin as soon as you get pregnant if you're taking insulin before. Exactly the same thing. Without proper medical advice and guidance, you should not be stopping it. So now I will talk briefly. I think we are running out of time as well. Briefly talk about International Forum for Wellbeing in Pregnancy. I'm quite proud to be a part of this initiative. Now, when we talk about mental health, we talk about, by default, we talk about mental health problems. But at the same time, there is another thing called positive and good mental health as well, which is important for all of us. And in fact, there is a term called well-being. I have a slide on that. So there is a term called well-being. This is well-being and wellness, very, very commonly used nowadays. So what well-being means, there are three things. There is most of the time we have to have a positive state of mental health, less negative feelings, and satisfaction with life. If you have this thing, then you are well, you can consider yourself well-being. It is always up and down most of the time. So what it shows now, there are a lot of evidence to suggest that if you have something, you can do something during pregnancy to prevent mental health problems from happening in the first place. So how you can do? You can improve your resilience or level of stress tolerance. How you can do that? Now, again, there are a lot of theories behind it. But one of the important factors, what we have found, that lifestyle modification and stress management. There are 4 things, that is diet, exercise, rest and relaxation. We are focusing a lot of things and many of the patients are getting better with that. So, this is well-being, and that is exactly what we are going to try to do through our International Forum for Wellbeing in Pregnancy. I will show you a short video and then I will conclude my talk and take up questions. And if the lights can go down while we are showing the video.
Pregnancy is supposed to be a time of happiness and joy. But 1 in 5 women suffer from stress and mental health problems during pregnancy. As an obstetrician, I have observed that pregnant mothers often do not get necessary information on prevention and stress management techniques. To overcome these challenges, our charity, International Forum for Wellbeing in Pregnancy, has developed a unique global pregnancy wellbeing program in partnership with World Health Innovation Summit, based on the fundamental principles of United Nations Sustainable Development Goal 3. In this wellbeing program, pregnant women can access our online resources and attend our workshops completely free of charge. Our another important goal is to provide health education to the society through our community events, our social media engagements, and also through online information. I feel extremely proud to be leading this charity along with our trustees and board of advisors from all across the world. Our global vision has been recognized worldwide, and we have been invited to share our values in many parts of the world. We created history at the British Parliament by running public events in 3 consecutive years, raising awareness. In 2018, there were over 6 million Twitter impressions on the day, making IFWIP the world's biggest conversation on well-being during pregnancy. Please remember that all of us can make a difference. So please get in touch with us today to join our global pregnancy well-being revolution. Thank you.
Thank you very much. With this, I would like to conclude my talk. And if you have any question, please feel free to. And please feel free to be a part of this initiative. I want people from all walks of life, from every corner of the world, to join us and help in spreading awareness. Thank you very much indeed.